All right, good morning. It is May 20th, 2025, and we are reading in the Habits of Health. We are in the preface. Welcome to the Habits of Health 2.0, and that is page 15. So, thanks for joining me, guys. So, almost a decade has passed since the first edition of Dr. A's Habits of Health. The following year, I followed it up with a companion guide, Living a Longer, Healthier Life. If you were to judge the system by its popularity and acceptance as a resource for those that want to improve their health and well-being, you might say it was an overwhelming success. In the last 10 years or more since it was published, we have reached over 500,000 people, thereby positively affecting the lives of countless individuals. On the side it says obesogenic. Obesogenic is likely to cause someone to become excessively overweight or obese. So the past decade has changed me forever. It has brought tears of gratitude that a physician who has spent most of his career focusing on treating and reacting to disease and its accompanying suffering is now part of a new movement and way of thinking that creates joy, vibrant health, and thriving lives for so many. Hearing the countless stories about lives that have been changed and reading the daily emails and letters sent to me by people describing their transformational stories is humbling and incredibly gratifying. It's also fueling a burning desire to improve and to provide an even more practical and effective way to help people change their lives. So, why has the first edition been so powerful and life-changing for so many? It was a refreshing and comprehensive approach to reaching and maintaining a healthy weight. Making the move to optimal health was innovative, simple, and explained in a way that made sense to people. It made bold steps, too. It exposed the futility of dieting, the ineffectiveness of the food pyramid, and the need for more movement than an hour in the gym a few times a week. It introduced the vital role of sleep in weight loss and health and the key role that support plays in any long-term success. From its basis in the sound clinical science, along with the questionnaires and exercises, to its innovative new ways of eating, moving, sleeping, and creating a more relaxed, healthy mind, the system worked together to help individuals take control of their weight and their health. But that was then and this is now. Many things have changed over the last 10 years, and I am very excited about sharing what I have learned with you. The science of human motivation and behavior, as well as the area of neuroscience, have seen rapid and remarkable expansion. Our understanding of how the brain and mind influences our behaviors continues to increase at a breathtaking pace. Unfortunately, this rate of change is making it hard for us to adapt. Many people feel their sanity, health, and overall well-being slipping away. That reality, the challenge we all face, has been the impetus and central focus of my work over the last decade. In fact, there is one question I have been seeking to answer. How can I help those that desire better health, happiness, and well-being make sense of it all? How can we transform to a more optimal way of living that supports the radiant health and vibrant energy when every day it seems like we are falling further behind in our weight, our health, our relationships, and our zest for life? Well, the good news is that it is actually all there, hidden in our habits, the software that determines almost everything. Beyond scientific advances, I've had an extraordinary opportunity to help tens of thousands of people face their reality. I've watched people tackle these challenges in their own lives, and I've been able to fully comprehend the subject I've written so much about. The habits of health are the answer. They can change everything. Sidebar, and I say page 18, but realistically the new updated version, the pages are a little bit off. So Dr. A says, If you don't own a copy of Your Lifebook, visit the Habits of Health website, contact your coach, or you can start your own journal in the notebook of your choice. But I will tell you, this book is life-changing. So, real, tangible, lasting change. I have passed the 10,000 hours of practice and experience with the Malcolm Gladwell suggests it take to become a master of something. And I believe that I have the authority to make the following statement. If you are willing to take responsibility and stay the course, we can help you predictably change your health and well-being. And I'm going to throw in here, change your identity. What you say to yourself is what you become. If you say, I'm addicted to sugar, you're addicted to sugar. If you say, I am not addicted to sugar, you will become that. It's a huge thing. I am a healthy person. I am not a yo-yo dieter. The book you are reading will be your guide. If you are new to my work, then let me offer you a warm welcome. If this work and thinking has helped you in the past, I promise you are in for a treat. The sequel, this book, is simpler yet more powerful than its predecessor. I've worked hard to make it better, more effective, and more in line with today's challenges. It will guide your mind and your body in equal parts. Its comprehensive approach will help you make the changes in both your health and well-being that may have eluded you. Alongside the writing of this second edition, I have evolved the Habits of Health Companion Workbook into an even more important and useful companion and tool. Used in parallel, it will allow you to build a new story, create a healthier you, and give you space to document your achievements and progress in a style that will help the transformation stick. That is why it's called Your Lifebook. It's the record of your journey, your goals, your ups and downs, but mostly it's your path to your desired health and well-being. Together, they are a highly effective system to create predictable transformation in those that decide their health is important to them. Let's take a few moments to reflect on the wider challenges we face as a world. In the first edition, I started the preface by stating very clearly that we live in an obesogenic world, a world full of factors that cause weight gain. Sadly, over the last 10 or so years, nothing has changed in terms of our access to seductively tasty, cheap, convenient, but unhealthy food. It's still here. In fact, it's more available and more affordable than ever. Energy-saving devices have become even more absurd. Activities such as shopping, learning, working, or entertainment that previously required physical energy can now be accessed from the comfort of our own homes, on a train, or sitting in a cafe. Our way of life is killing us. Yet, when it comes to our own lives, certainly in the developed world, everything has changed. The fabric of society has changed. Our lives have become more chaotic. Just coping with ever-increasing pressures of everyday life is pushing people to irresponsible actions. Irrational behavior, from violence, crime, and public defiance to acts of personal and social irresponsibility, is eroding a long-range common sense approach to modern living. The result is a growing cost to every aspect of our society and a direct effect on both our physical and mental health. At the time of writing, the U.S. leads a worldwide trend in weight gain. Almost 70% of the population are overweight or obese. The resulting acceleration of sickness and disease is having a catastrophic effect on the nation. For the principal cause, look no further than the advancement of technology. We will build a case in part 1.1. It's not your fault that you're struggling. That adapting both physically and mentally to the continuous impact of technology has caused significant collateral damage. The role that processed food plays in terms of quality and quantity, sorry, um, the reduction of physical activity and lack of exposure to natural world is resulting in a worldwide human migration. We are truly becoming a species that lives in the great indoors. Today, kids spend less time outside than prison inmates. Wow. The average child plays freely outside for just 4 to 7 minutes a day. The aggregate effects on our health and well-being are not good. Estimates suggest that by the year of 2020, depression will be the second leading cause of disability throughout the world. The first is heart disease. And now with it being 2025 and having gone through the COVID thing and depression and community, the lack of community is high. Despite all of the apparent benefits of modern life, a recent survey said that we are the first generation that has significantly lower quality of life than every generation before us. Clearly, our inability to handle the pressure and stress in our lives can have devastating effect on our attempts to create optimal health and well-being. It affects our children, our teachers, our schools, our jobs, our relationships, our neighborhoods, our communities, our countries, and our planet. So you might reasonably ask why I'm bringing this up in the introduction to a book about health and well-being. The answer is simple. We will need to spend time addressing your own current relationship with the world and how you respond, not just the good days, not just on the good days, the vacations, and the great job you did at the office, but to those days when you feel that the air has been let out of your balloon. It's on those days that we all need some help in order to get our minds to operate in a way that can effectively support optimal health and well-being. A strong infrastructure of support for our thinking and doing and interacting with others is crucial to create sustainable success. So, in the evolution to Habits of Health Transformation System 2.0, we will include significant amounts of new information and equip you with new ways to interact with the world in a more effective way. Put simply, the world cannot change quickly enough to better serve the health and well-being of man. The Habits of Health mind and health relationship will help you respond differently. Our goal is to give you a blueprint for taking personal responsibility and adaptive to change. I have always thought that Charles Darwin's most significant contribution to mankind was not the premise of survival of the fittest, but instead the proliferation of those that are most adaptive. And for the human race, I fear that unless we make an immediate adjustment to the escalating pace of change, our future existence is in question. This book is an important step in that direction. In the following pages, we will outline step by step how you can reach and sustain a healthy weight. I will start by helping you learn and install a new set of habits that will create sustainable transformation. I will equip you with the strategies, tools, and support necessary to take the challenges this rapidly changing world presents to you on a daily basis and have you gobble them up like energy bars. Our goal is to provide you with an owner's manual that will help you thrive as you continue this crazy journey called life. So if you're ready, let's start the process of taking control of your future health and well-being. In Health, Dr. Wayne Scott.